All right, today we're diving into the story of a medication that's been around for decades, but honestly, its design is so smart, it feels like something straight out of the future. We're talking about sulfasalazine. And right away, we hit the central puzzle of this drug, right? I mean, how can one single pill be used to treat two problems that seem totally unrelated? You've got inflammation deep inside your gut, and then you have painful, swollen joints. Well, the answer is just a fantastic piece of chemical engineering. So, how on earth does it work? Well, the whole secret sauce is this idea of a prodrug. The best way to think about it is like a medication that's shipped in a locked box, and that box is designed to only pop open right where it needs to be. Okay, so what is a prodrug exactly? It's pretty simple, actually. It's a medicine that you take, but it's totally inactive when you swallow it. It's just sleeping, you could say. It's designed to just cruise through your system, completely inert, just waiting for a very specific key to unlock it and flip the on switch. So, what's in this locked box? Well, sulfasalazine isn't one thing. It's actually two different medicines chemically bolted together. You've got 5-ASA. Think of that as the gut soother. It's an anti-inflammatory that works right there in the colon. And then you have sulfapyridine. That's the joint helper, which is designed to fight inflammation all over the body, like in your joints. And the lock that's holding these two parts together, it's a special chemical link called an azobond. And you got to remember that name because this little bond, it is the absolute key to the whole design. You're about to see why. Okay, so let's follow this pill on its journey. Before it can do anything useful, it first has to survive a pretty tough trip, a real digestive gauntlet through the stomach and the small intestine. And here's where that azobond really shines. It's like a shield. It's built to be super tough, completely ignoring all the harsh stomach acid and the digestive enzymes that are trying to break it down. This is absolutely critical because it makes sure the drug doesn't just fall apart and release its contents way too early. It stays locked up tight. So, after surviving that entire journey, the pill finally makes it to its destination, the large intestine, the colon. And this is where the really cool part happens. This is where the medicine finally gets unlocked. You see, this is where the magic happens. The trillions of bacteria that live in your colon, your gut microbiome, they produce these special enzymes that our own bodies can't make. And it turns out, these bacterial enzymes are the one and only key in the entire body that can snip that azobond. Just like that, pop, the two medicines are released, exactly where they need to be. It's brilliant. So, the box is unlocked. Our two agents are free. Now they can finally get to work, and each one has its own very specific mission to tackle inflammation. Okay, so once they're released, these two molecules go their separate ways. First, the 5-ASA. It stays right there in the colon. It works locally, right on the gut lining, to calm down the inflammation you see in something like ulcerative colitis. Meanwhile, the other half, sulfapyridine, gets absorbed into the bloodstream. It goes systemic. It travels all through the body until it reaches the joints, where it works to suppress the immune attack that's causing all that pain and swelling in rheumatoid arthritis. See? One pill, two totally different jobs. So because of this super clever dual-action design, it's no surprise that it's a go-to treatment for both ulcerative colitis and rheumatoid arthritis. For arthritis, it's what's called a DMARD. That stands for disease-modifying anti-rheumatic drug. And that name is important because it means it doesn't just mask the pain, it actually gets in there and helps slow down the real joint damage. It's also prescribed for other inflammatory stuff, like certain kinds of arthritis in kids. Okay, so that's the cool science behind it, but what's it actually like for someone taking it? Let's switch gears and talk about the practical side of things, what you can expect in your daily life. Now, to help your body get used to it, doctors have a golden rule. Start low and go slow. They'll gradually ramp up the dose over time. And there are two really big tips for anyone taking it. Number one, always take it with food or right after a meal. This really helps with stomach upset. And number two, drink plenty of water throughout the day. It's super important. All right, let's talk about something a little surprising. There's a super common side effect that's totally harmless, but yeah, it can definitely freak you out if you don't know it's coming. And here it is. This medication can actually turn your urine and sometimes even your skin an orange-yellow color. It can even stain your soft contact lenses. The key thing to know is this is completely normal and harmless. It's just a weird quirk of the drug, and it goes away if you stop taking it. So really, don't be alarmed if it happens. Some other common things people run into, especially at the beginning, are things like nausea, headaches, or maybe not feeling as hungry. A lot of the time, this is tied to the dose. But the good news is that for most people, these things tend to get a lot better, or just fade away completely as their body adjusts. Okay, this brings us to our last section, and it is probably the most important one. This is a powerful medicine, and to use it safely over the long haul, it really requires a partnership between you and your doctor, and that partnership involves regular monitoring.
So why all the monitoring? Well, think of it as a safety net. The regular blood tests are there so your doctor can keep an eye out for rare but serious side effects, things like changes in your blood cells or how your liver is doing. It's not about risk, it's about being proactive. It's a safety feature that's just built right into the treatment.
So what does that schedule actually look like? Well, you'll get a test done before you even start to get a baseline. Then, for the first 3 months, it's a bit more frequent, maybe every 2 to 4 weeks. But after that, once everything is stable and looking good, it usually relaxes to just once every 3 to 6 months. And really, this quote just wraps it all up perfectly. It's that combination, the start low, go slow approach, paired with careful, consistent monitoring, that's the real key. That's what has made this drug a safe and successful option for so many people for so long. Which really leaves us with a final, fascinating thought. You have this drug that's, 80 years old? And yet its core design, hijacking our own gut bacteria to deliver a targeted payload, feels incredibly advanced, like something we'd be designing today. It just makes you wonder, what else can this old workhorse of a drug teach us as we try to design the next generation of smart medicines?